Welcome to the Deep Dive. We take your questions, your sources, and we really try to unearth the most important insights. Today, we're diving deep into something that, well, it affects all of us, the future of capitalism, maybe, and its surprising connection to, well, the state of global healthcare. You sent in some really thought-provoking stuff, exploring how economic power structures, might actually be contributing to suffering, especially in medicine. We'll look at everything from how capitalism itself might be evolving to the very real concrete challenges facing healthcare systems right now. And then, importantly, we're going to unpack a really revolutionary approach from a Dr. Karyali Srivatsa and his Dr. Maya GPT system.
Yeah, it's fascinating, isn't it, how these sources connect ideas that seem, on the surface, pretty separate. We're going to explore how, profit motives have gotten deeply embedded in systems that were meant to help people. And then we'll look at this counter-narrative, one that really aims to put health, actual health and knowledge back at the center. Our mission today really is to connect these dots for you so you can grasp the bigger picture and what it might mean for all of us.
Okay, let's start there then. This idea that capitalism itself is undergoing some kind of profound transformation, the sources suggest we might be moving into something new, maybe even post-capitalism.
Indeed. Yeah, one perspective in the material suggests that, for some of the ultra-wealthy anyway, the old goal, financial profit, is maybe being deprioritized. Instead, wealth, true wealth, is becoming less about money, less about direct profit, and more about, well, control, power. We're seeing this shift towards what's been called a rent-based economy.
Yeah.
Fewer entities owning things, more people just renting everything, software, homes, you name it. And this isn't just about convenience, it's a fundamental change in what gives influence.
Yeah.
What constitutes power?
And here's where it gets really interesting, or maybe a bit unsettling. The idea that this isn't just happening by accident. One source argues pretty strongly that the rules themselves, the regulations, the social contracts, the glue holding society together are often shaped and enforced by those already in power, specifically to keep that control.
Right.
It creates these sort of elegant cages, the source says, for the powerless, while the powerful kind of live above the rules, like a two-tier system.
That's a really crucial observation. And it raises this tough question. If suffering itself can become a kind of business model in a system that maybe prioritizes profit over people, what does that mean? What are the implications for society? The sources suggest pain itself has been commodified.
Commodified pain, wow.
Yeah, meaning suffering isn't just some unfortunate side effect, a bug in the system. It's potentially a product, something to capitalize on. I mean, think about it. Chronic conditions managed forever instead of cured. Preventative health, maybe taking a backseat to expensive late-stage treatments. When suffering generates revenue, the incentive to truly eliminate it can shrink. And that can lead to deep inequality, right? You see it in shrinking tax revenues, eroding social safety nets. It sort of feeds this cycle where power often gains from the struggles of the less powerful.
Okay, so bringing that focus now, what does all this mean when we look specifically at healthcare? It seems like these same profit-driven dynamics are very much at play, maybe even more intensely.
Absolutely. The consequences feel much more direct, don't they? The sources paint a pretty critical picture of the, quote, medical industrial complex. We learned, for instance, that an alarming 90% of people over 65 in the U.S. are on at least one prescription medication.
90%.
90%. And get this, 40 to 45% are on 5 or more. 5, that's polypharmacy. And it's described pretty bluntly as a bonanza for pharmaceutical companies. It really highlights how the widespread, often long-term use of drugs, especially antibiotics and other meds, has become a primary engine of the healthcare economy. It fuels huge profits. The sources suggest that in this system, antibiotics and drugs, they've almost become the main currency.
And it's not just the sheer number of drugs, is it? One expert points out that often maybe half of these meds are unnecessary, sometimes even prescribed just to treat the side effects of other drugs the person is taking. It's like a cascade.
You hit on a key point there. It is a cascade. And if we connect this to the bigger picture, many healthcare systems today are described as doctor-centered, right? And financially driven. They reward volume, more tests, more procedures, more pills, not necessarily value, not patient outcomes. Studies suggest around 20% of medical care might be unnecessary, driven partly by fear of malpractice, sure, but also crucially by profit motives. Over 70% of doctors in one survey actually believe profit encourages unnecessary procedures.
Wow.
So the system, in effect, incentivizes treating symptoms, often with drugs, rather than preventing illness in the first place. And it leads people to believe, maybe, that only doctors and drugs can save lives, rather than, fostering holistic health or proactive well-being.
The NHS in the UK comes up as a really stark example of this pressure. 7.5 million people on waiting lists, hundreds of thousands of staff jobs unfilled.
Yeah.
The system is just overwhelmed, leading to dangerous delays. It really points to a global lesson, doesn't it?
It does. Even well-meaning public systems can buckle if the resources aren't allocated smartly. And especially if that underlying economic model, where pain can be a business, isn't fundamentally challenged.
So facing this huge systemic crisis, the sources bring in Dr. Katyali Srivatsa, a figure who really challenged things. What did his journey show him about the roots of these problems?
Well, Dr. Srivatsa's path was interesting. He started in pediatrics, then family medicine. And this gave him a front row seat to these deep systemic flaws. He found that doctors often weren't truly listening to patients' stories, not doing really thorough clinical exams. Instead, they were meticulously following guidelines, documenting everything, often to protect themselves legally.
Right, the defensive medicine aspect.
Exactly. And this frequently led to overprescribing antibiotics or referring patients off to specialists as soon as things got a bit complicated or worsened. His observations made him question the whole foundation. How modern medicine often prioritizes fear and profit over genuine healing or understanding the patient's whole story, or even the interconnectedness of our biology. He started seeing this disturbing parallel, actually, between the turmoil in the capitalist system, that two-tier structure, the control, and the way medicine often approached the microscopic world.
How so?
Well, like dominating and inflicting harm, maybe through overuse of antibiotics rather than understand the delicate balance. He saw it mirroring the larger system's issues.
And it sounds like he faced quite a bit of pushback for these insights, almost like a, quote, conspiracy to hide the truth about these systemic issues, especially around things like licensing nurses to prescribe in the NHS. He saw that as a disparity created by the elite's investment in pharma in the existing hospital system, a system designed, he felt, to inflict fear and then profit by selling drugs that, as one source puts it, seldom cured.
Precisely. It fostered that belief. Only drugs and doctors save lives. And his work really underscores that idea from another source, that unawareness is incentivized in these big, complex systems, that the default setting is concealment. So Dr. Srivatsa's perseverance in developing his Dr. Maya system, despite facing professional backlash, institutional resistance, it really highlights his belief. His belief in truth as the way to address what he saw as this looming global healthcare collapse. He felt he had to challenge that narrative that dominating the microscopic world with drugs was progress. He argued it mirrored the capitalist system's turmoil and was just unsustainable.
So Dr. Srivatsa's answer, his innovation, is Dr. Maya GPT. And this isn't just another symptom checker app, right? It sounds like it's designed to fundamentally change that healthcare currency we talked about.
Not at all. No. Dr. Maya GPT is an AI tool, but it's founded on his unique intuitive learning concept. It's an approach designed to make complex medical decisions understandable for everyone. Using simple color codes, symbols, clear language, it leverages our innate pattern recognition. It really empowers individuals, even those with literacy challenges, to understand their own health status. It functions like a virtual junior doctor, you could say.
Yeah.
Meticulously designed to simplify healthcare decisions, reduce the burden on the whole system, and move us toward a truly patient-centered approach where shared information, is key.
And that color-coded triage system, that sounds particularly innovative. Tell us more about how that works, how it helps prevent the system getting swamped.
Right, it's a clinically tested system, very intuitive. 4 main codes. Red, that's for severe symptoms, means get medical help immediately, no delay.
Okay, straightforward.
Blue, this one's crucial. It signals infectious symptoms, requiring isolation to stop disease spread. This is absolutely vital for surviving in what many are calling the post-antibiotic era, a scary future where simple infections could become deadly because our drugs don't work anymore.
So blue is about containment.
Exactly. Early detection, containment, reducing the need for widespread drug use, that traditional currency.
Yeah.
Then green, mild symptoms, not immediately dangerous, but you'd benefit from talking to a health professional, like a nurse triage line, for advice. And yellow, lowest urgency. Things you can usually manage at home, maybe with a pharmacist's advice.
That sounds like it directly tackles the problem of overflowing ER's unnecessary appointments. It frees up doctors for the really serious, the red cases. It really does shift the focus, the currency, from just pills and appointments to informed action by the patient. Early appropriate intervention.
Precisely. The aim is to prevent huge outbreaks, like COVID-19, which cost trillions globally, right, by enabling early detection and isolation right down at the individual level. And it's also about improving universal healthcare access,
Hmm.
especially in underserved areas, giving immediate, reliable advice. And crucially, it's built on this principle of non-exploitative AI healthcare,
Meaning,
meaning it operates on a simple, very affordable subscription, just $9.99 a year. This ensures it stays independent. No ties to big tech, big pharma, or political groups. The goal is honest, unbiased care advice. It's a direct move towards a system where accessible information, not just antibiotics or doctor visits, becomes the key tool for survival and well-being.
okay, this all sounds incredibly positive, a real potential game changer. But if Dr. Maya GPT is so impactful, why isn't it everywhere? This brings us right back to that core issue, the problem of harnessing its power within this capitalist-controlled world you
Well,
mentioned.
that's the million-dollar question, isn't it? And it echoes through a lot of the source material. Why do established systems resist change, even change that offers clear, profound benefits? The sources hint at something like that old monkey experiment idea, where established norms just persist even when the original reason is long gone. Inertia.
The existing capitalist-controlled world, with its massive, deeply embedded investments in pharma, in hospitals, in the current profit-driven healthcare model. It's built a very lucrative business around commodified pain, profit from sickness. The main currency there isn't really health. It's managing illness, selling products, selling procedures.
So when Dr. Srivatsa identifies the root cause of disparity as being this elite investment in systems that inflict fear and then profit from drugs that seldom cured, Dr. MyGPT fundamentally threatens that whole revenue stream. It challenges that core idea that only drugs and doctors are the saviors by promoting knowledge, patient action, early intervention instead.
Exactly. That's the heart of the resistance. If AI, like Dr. Maya, can genuinely replace a big chunk of what doctors do now, maybe 80% of routine stuff, one VC suggested, because it's available 247, costs far less, and might even show more empathy because it doesn't burn out.
Well, that represents a kind of healthcare apocalypse for the old way of doing things, the traditional medical paradigm. The system that currently profits so much from illness just doesn't easily embrace a solution that, as Srivatsa argues, saves costs, saves lives, and delivers healthcare grounded in ethics, not profit.
So the resistance is about protecting power, protecting profits.
Deeply rooted in protecting those existing structures and profit flows. The sources argue that universal implementation of Dr. Maya GPT, based on honesty, based on shared information, isn't just a good idea. It's presented as maybe the only viable option for us to survive a post-antibiotic era. It directly confronts a system that, in many ways, thrives by making pain a business.
We've really covered some ground here, seeing how the structure of capitalism itself, maybe prioritizing control and profit, can show up in a healthcare system struggling under the weight of, well, commodified pain. And then seeing how a visionary like Dr. Kalalis Srivatsa offers this disruptive, patient-first path forward with Dr. Maya GPT, a system designed to empower us, prioritize health, not just profit.
Yeah, this deep dive really throws a fundamental tension into sharp relief, doesn't it? What happens when a solution truly designed for universal well-being, maybe even survival, directly challenges a system that's become optimized for financial gain? It really makes you wonder, what if that main currency of health genuinely shifted, away from just antibiotics and endless procedures, towards accessible information, proactive prevention, individual empowerment?
So as you listen, what stands out to you from this deep dive? Maybe it's the uncomfortable idea that systems sometimes resist healing because, for some, pain is actually profitable. Or maybe it's the inspiring potential you see in patient-centered AI like Dr. Maya, offering that glimmer of hope for a truly post-antibiotic era where health is treated more like a right, not just another commodity. And here's a final thought to leave you with, something provocative perhaps. In a world where, as one source put it, unawareness is rewarded, and maybe simplicity wins just because it's comfortable, what collective truth might we be actively avoiding? And what truly transformative changes could genuinely improve our well-being if we, collectively, chose to face it?